550 KTRS. Yesterday, a historic day because two courts said the exact opposite an hour from each other. Ryan Barker, Vice President of the Health Policy for the Missouri Foundation for Health, joins us. Good morning, Ryan Barker.
Good morning.
You've our go-to guy on this, but quickly tell people what the Missouri Foundation for Health is.
We are a nonprofit foundation. Most of what we do is grant making and funding of nonprofit organizations across the state to help make Missourians healthier.
And you have been our fact guy, so you've been on here. You don't give your opinion, but you give the facts on what the law says.
Absolutely.
Okay, so what happened yesterday?
It was an interesting day. There is several court cases that have been moving up through the courts that are challenging a small part of the law, which actually was a drafting error, that related to whether consumers in federally run marketplace states can receive premium subsidies.
Okay, like Missouri. Missouri's run by the feds because the state of Missouri did not want to set up their own state fund, chose to instead have the feds do it. Illinois has a state run, correct?
They have a partnership marketplace. So it actually affects them too. So there's 36 states that have either a federally run or a partnership marketplace. There's only 14 that have set up their own state-run marketplace.
Okay, so the one court ruled that you can't have subsidies for the federally run insurance. An hour later, the other court said these subsidies for federally run exchanges are perfectly fine.
Yes.
Now, was the other one in response to the first panel?
No. So they were two different court cases that had been moving up through the lower courts. Up until yesterday, all of the lower courts had ruled these subsidies were fine in federally run marketplace states. Yesterday, the Fifth Circuit in D.C. is the one that said, no, these subsidies are not okay. It was a 2-1. It's a 3-judge panel. 2-1 said no. And then an hour later, the Fourth Circuit in Virginia, so very close, said 3-0, said these subsidies are fine.
Okay.
So, yeah, very conflicting. So we know right away this is going to keep moving up the chain. The administration has already said they're going to request the full circuit court in D.C., which is 11 judges, to review the 3-judge opinion.
Right. So before it gets to the Supreme Court, the full court in D.C. has to hear it. And if they deem it to be unconstitutional or not allowed, then I guess the Supreme Court has to step in?
Yeah, so if the 11 judge panel still says no to the premiums in the federal marketplace states, then there would be conflict between the circuit courts, and the Supreme Court would have to intervene. Now, if the 11 judge panel comes back and says the subsidies are fine and all the circuit courts are in agreement, the Supreme Court could say, we don't want to take the case.
But they could also say we want to take it.
They also could take it.
Yeah. Now, how many people have signed up for healthcare.gov in Missouri? Do we have any idea?
Oh, yeah. We so as the last numbers I've seen were about 155,000 Missourians.
So if this goes away, 155,000 Missourians the next day lose their federal subsidy.
Well, so of that 155,000, about 85% got a federal subsidy. Okay. So a large chunk, I can't do the math that quick in my head, got subsidies. So yes, if this would all play out, but the important thing to note is, as of right now, nothing changes for the consumer. They still get their premium subsidies. If you sign up today, you get your premium subsidy. If you signed up 6 months ago, you still get it. This is going to take a while to move through the court. And if it ends up at the Supreme Court, they don't usually put out rulings until June. So we're talking almost a year before we would know.
Right.
This 3-panel, I want to go back to this 3-panel because 2 were under the Bush administration, right?
I think so, yeah.
And then 1 not.
Right.
How were they appointed to make this decision?
Well, these, the of the 11 judges, this is how it often works: is 3 judge panels hear a case, and the whoever's the plaintiffs or defendants can always request after they've made a ruling for the full circuit court. It's just a way for them to handle more cases.
What did you get any phone calls? People worried about losing their own health insurance? Did you get? How was your day yesterday?
We did not get any phone calls from consumers, but we work with a big coalition of people who are doing the assisting, so they're helping consumers.
Right.
And so right away, my email was lighting up yesterday. What does this mean? What can you help? So that's our job. So we sent out an email to our coalition saying the important thing: things continue. This does not affect consumers right now. You can reassure people that they will still get their subsidies.
If it were to be deemed that the federal subsidies wouldn't work, and the 85% of the 155,000 people are thrown off the rolls, insurance as we know it, I mean, talk about a disaster, because the insurance companies lose those. Therefore, the pool gets smaller. They don't have enough money to cover everybody who is insured. Our insurance rates would skyrocket, would they not?
Well, so what would happen is people would have to pay full price for their insurance in the marketplace, and most people are not going to be able to afford that. So many of us that get insurance through our employer aren't paying full price because our employer kicks in.
Right.
But people who use the marketplace, they're on their own as either an individual or a family, and that's why these subsidies are so important, is because it helps them afford this. If there's no subsidy, people are just going to see the full price of their insurance, and most of them won't be able to afford it.
But they're buying insurance from the same company that I'm getting my insurance from. And so if the insurance companies all of a sudden don't have the money coming in for the quote unquote uninsured or the marketplace people, then ultimately doesn't that jack up my price?
It could. I mean, what I imagine what would happen is most people would drop their insurance from the marketplace. And remember, a year ago, we didn't have a marketplace.
And then go to the emergency room.
Right. Except there's all sorts of issues if we go down that. I mean, literally, as people have been talking about, if this would move forward and the subsidies would be deemed illegal, the ACA would have trouble moving forward. I mean, it really would have it has an impact on the employer mandate that hasn't kicked in yet. That kicks in next year, in that their employers would probably not be penalized because of that employer mandate, because there's this whole thing about affordable insurance. Well, if you don't have subsidies in the marketplace,
right,
the insurance won't be affordable.
Of the 155,000 that are getting their insurance through the market exchange here in Missouri, are they paying? Is it working? What's the early numbers from that?
Yeah, so interestingly, our coalition meets monthly, and we have been hearing from a lot of our navigators and certified application counselors that the consumers are doing what they're supposed to be doing. They're paying their monthly bill. They're trying to use preventative care, find a primary care doc, and the struggle is with the insurance companies. So we are having difficulties. One, it was such a large number of people entering the system. I don't entirely blame the insurance companies. They got swamped.
Right.
But they are having trouble processing all of the payments, getting people in the system. And then they're supposed to have adequate networks of providers, but people are having a tough time finding a provider, which I think we've talked about this before. We have a provider shortage in this country, especially when it comes to primary care. So this is this is an issue that we're going to have to continue to address. Now, the issue of workforce shortage is a state-based issue. That's an issue Missouri's got to pick up and start talking about.
What do you mean? Explain that.
There are some national solutions, but at the same point, every state is so different in terms of we have different rules and regulations about who can practice, what can a primary care doc do compared to a nurse practitioner. Those are state-level laws. So when you're talking about trying to address workforce shortages, which some of the solution is let a nurse practitioner practice up to the scope of what they've been trained to do. Mm-hmm. Missouri has some pretty strict restrictions on what other health professionals are allowed to do.
So you're saying the federal exchange and the state laws are clashing? Is that a safe way of saying it?
In a sense, in that what the Affordable Care Act was meant to do was really increase coverage, increase the number of people who have insurance. Now, using that insurance is on the top of our list of helping consumers be responsible. Don't go to the emergency room when you don't have to. But part of that is making sure we have an adequate primary care system that can see people so they don't need to go to the ER.
Right.
And that's something Missouri needs.
We're starting to see, I'm sorry, Kelly, we're starting to see a lot of urgent care places sort of pop up. Is that part of the Affordable Care Act? Is that in response to it? Is that in spite of it? What's going on there?
I don't know if it's completely related. I think some of that is the pressure of it is. I think some of that may be pressure from insurance companies because urgent care is cheaper for them than an ER.
Right.
And we know that primary care docs, they're aging quickly, they're retiring, and we have major shortages. So urgent care is sort of an in-between those two. Urgent cares often have more flexible hours.
Right.
And so that's very appealing to consumers. So some of this, I think, is consumer-driven, and some of it is sort of health system-driven of trying to get people out of the ERs that don't need to be there.
I was going to say, when it came to the doctor shortage and the nurse practitioners and their roles, so that would be up to Missouri lawmakers to be able to loosen those laws to be able to have nurse practitioners have more power and be able to see more patients, right?
Yeah, and then we have quite a few really interesting programs in Missouri. We have a pipeline program that really tries to follow students from middle school and encourage them to get interested in science and get into follow them from middle school all the way through medical school, because what we know is if you come from a more rural area, you're more likely to go practice in that rural area. And that's where we see the most acute shortage.
So you're saying that in rural Missouri, there is just no doctors and no nurses.
There is a new report just recently came out from the Hospital Association here in Missouri, and we saw some growth in primary care in the urban areas. It's still not enough, but we actually saw drops in the number of primary care providers in rural Missouri.
Wow. That's Ryan Barker. He's the goods. He's the facts man, Vice President of the Health Policy for the Missouri Foundation for Health. Place to go for more information. Is there?
covermissouri.org, and you can follow us on Facebook and Twitter at Cover Missouri, and that is where stuff like these rulings in the court, you'll mostly follow us on social media for that.
Ryan Barker, great as always. Thanks for coming in.